Yeah.
Good evening, Damilare. Good evening, Deji. You're all welcome. Trust we are all fine. Good evening, Sir Francis. Trust you are all good and trust that the Wednesday has been Wednesdaying well. Even if that is a bad English, I'm 110% sure that you understand what I'm saying, and I trust that we have been having a great day so far. So you're all welcome again to another edition of our monthly digest for the month of August. You're welcome. And just as a mind reminder, this is a gathering for all of us as curators for Pioneer Medical Initiative for us to learn and expand our knowledge base. And this is one way that PMI is giving back to us, right? So we are all welcome once again, and it's a good way to start the another section for today. Good evening, Pomile. You're welcome. So just before we start, I would like us to do a short exercise. As you can all see, we are just, I think, let me see, 1, 2, 3, 4, 5, 6, 7, 8. We are about 9 on this score right now. And this goes a long way to tell us that this is a low turn up. And if I'm not making a mistake, we're having up to like 150 on the group, people on the group. So we're having a low turn up, obviously. So I would like everyone, at least one curator that you know, and you can reach out to just before we kickstart the section. If you can reach out to at least one curator to join us at this time, just so before we start the section. I would like everyone to participate in this, please. Are we all together? Hello.
Yes, we're all together.
Oh, thank you. So I trust that everyone is going to do this. At least one curator reach out to him or her that we are about to start and he or she should join us before we embark on this journey. So I'll be expecting we will be starting by 10 minutes past 5. So before then, in the meantime, let's try to do this. Just send a message, can be a message or a call to anyone that you can reach out to the next 1 to 2 minutes so that they can join us before we start. Favor, good evening. You're welcome.
Thank you.
Yeah, I hope you're fine.
Yes, I'm very fine. I hope you're fine too.
Yeah, I'm good. Thank you very much. I'm good. You're welcome. So we have 1 minute to start. So if you have not sent a message to at least one person, please, this is another reminder for you to do so, please. Please, at least one person that is available to join us before we kickstart the section.
Thank you. You're welcome.
All right, it's time. So thank you very much for those that participated in that assignment. Thank you very much. So and I'm looking forward to more people joining probably in the middle of the section. Thank you, thank you, thank you. So we'll be starting the discussion now, and I trust that our facilitator is here with us, the person of Musa Olaoluwa, Mr. Musa Olaoluwa. Um, just like as a means of brief introduction, Mr. Musa Olaoluwa is a researcher and a human anatomy specialist, and most specifically, is a public health advocate, as we like probably also are. So we'll be taking us through the topic diet lifestyle, and NCDs, non-communicable diseases, with a focus on hypertension in youth. And it's going to do this with respect to a data survey. So basically, what this section, this is just a way of saying my own expectation. I believe this section is a very important one that seeks to investigate the relationship between our diet, our dietary pattern, and the lifestyle, our lifestyle choices, and how it relates to non-communicable diseases with a focus on hypertension, especially in youth. So I am expecting that we are going to learn a whole lot of things from this section. And at this point, I would like to hand over to Mr. Musa Ololua. Thank you very much as you take over.
All right. Thank you, Kyoto Sheriff Dean. Good evening, everyone. So good evening, Christiana. All right. So I would like this to be like an interactive session. And I know that some of us probably on our way somewhere or we're trying to like do one or two things at the same time, listen to this, meeting. And we appreciate that uh, you made time to be here. That's like the most important thing. And we're grateful for that. So without like wasting much of our time, further ado, I've prepared like a slide. So I would be displaying this slide in a moment. Okay. All right. Can you all see my screen?
Yes, it's conversing here.
Okay. All right. Can you see my screen?
Yes, I can.
All right. So today's topic is
Yes,
I
sir.
want another person to respond apart from I think Ajayi Simon and the Sheriff Dean. I want to be sure that we're all here.
I can see a screen.
All right. Thank you, Deji.
I can see your screen.
Same here, I can see your screen.
Thank you, curator, lead curator, formerly. I can't hear CFO Francis' voice yet. Is he here? All right, let's move on. So the topic or the title for today is diet, lifestyle, and NCDs, with our focus on hypertension in youth, which is basically a data survey. Right. So most of the time we hear hypertension. Like when we hear the word hypertension, diabetes, what comes to our mind is basically the older generations, our dads, our moms, our grandparents. This used to be peculiar with them, but currently there's a there's a current shift towards the youth now having cases of raised blood pressure, increased diabetes, one of these things or the other. And majorly two major factors that like influence this thing, as we all know, is diet and lifestyle. So we're taking like a little bit of depth into it so we can see what it is, what causes it, what are the complications, how we can avoid it, or what are the lifestyle choices that we actually do that can increase our risk of having this NCD. All right. So basically, what are NCDs? Right. So NCD stands for non-communicable disease. They are like a group of diseases that are not infectious. So it means that it cannot be transmitted from one person to another. So he's saying if Mr. A has hypertension or diabetes, there's no way Mr. A can transfer it or transmit it to Mr. B, whether through whether orally or maybe through sexual intercourse. So NCDs are non-communicable diseases. So we have communicable diseases like the STIs and the rest, but non-communicable diseases they are not carried by infectious agents, so they can't be transmitted from one person to the other. But they are actually chronic and they can be long lasting. It means somebody can have NCD from like a very early stage in their life and it stays with them till the last stage of their life. All right. So going to the next slide, we have different types of NCDs. So NCDs are like a major public health challenge worldwide, and they are responsible for a significant proportion of premature death. And the major factors are unhealthy diet, physical inactivity, and unhealthy lifestyle. So different type of NCDs exist. So we have the ones that are blood vessels related, cardiovascular. So they have to do with the heart or the blood vessels, such as hypertension, coronary heart disease, angina, heart attacks, and the strokes that we know. So they are non-communicable. diseases. We have diabetes, which has to do with the blood sugar. So when the body does not have the ability to produce insulin itself, right? So we have diabetes, blood vessels related, and we have others like obesity. Obesity is actually a disease currently. Obesity is classified as a non-communicable disease. We have cancer, we have CRDs. CRD stands for chronic respiratory diseases. We have musculoskeletal diseases. Even mental health currently is classified under non-communicable disease. We have mental health issues and then neurological issues too. So these are like types or classifications of NCDs. So, but today we'll be focusing on hypertension, right? Are you following? Hello, is anybody following me?
Yes, yes. Yes, we are following you.
All right, all right. So we'll be focusing on hypertension. So just to do a quick recap, we introduced NCDs. We said they are like diseases that cannot be transmitted from one person to another. So NCD stands for non-communicable diseases. And then we said that they pose like a worldwide problem. And then the major risk factors are unhealthy diet, physical inactivity, and maybe unhealthy lifestyles too. So we went further to say different types of NCDs, like the ones that are cardiovascular or blood vessels related, like strokes, like heart attack, like hypertension, coronary artery disease. And then we also had diabetes that had to do with insulin, blood sugar level. And we mentioned others like cancer, meningitis, CRDs, chronic respiratory diseases, musculoskeletal diseases, neurological diseases, or mental health issues. So today we're focusing on one of the cardiovasculars, one of the blood vessels related one, which is hypertension. So basically, what is hypertension? For some of us who are studying or who studied, architecture, vision and urban planning, so this is like a way to get, a medical insight or a health insight into what hypertension is. I'm sure hypertension is a very popular word and a lot of people hear it. So, or you hear blood pressure, blood pressure. So, hypertension is also known as high blood pressure. So, your blood is supposed to have a particular pressure, but then when that pressure is very high or high to above the normal range, we call it hypertension. So, it is a common and significant non communicable disease characterized by elevated pressure in the arteries. So, two major points. Hypertension is often considered a silent killer, and then because it typically does not cause noticeable symptoms. Now, this is to say that it's possible for someone to be living with hypertension, right? And the person goes to work every day or goes to class every day, comes back, and the person does not have headache or does not feel tired or anything, but the person is living with hypertension. Now that's why they call it a silent killer because it won't pronounce itself. It's not like smallpox. When you have smallpox, it shows on your body. When you have chickenpox, it shows on your body. But if somebody has HIV, it shows on your body, right? So it's very silent. It's just there. And then it has its own counterpart in the communicable disease that is also a silent killer. That's hepatitis, another day discussion, right? So this hypertension is referred to as the silent killer. So when one has an elevated or a high blood pressure, there's high possibility that it will reflect in the morphology of the person or the physical things that you can see with the person. So point two states hypertension is a serious health condition, but with appropriate lifestyle modifications, early detection and proper management, you know, it is very serious. But when something called early detection is we'll get there at the end towards the later part of the discussion, but you should know that it's a very serious condition. But when there's proper management or early detection or change in lifestyle or modifications and all of that, it can easily be curbed. All right. So blood pressure parameters. Now, blood pressure is typically measured using two numbers, the systolic and the diastolic. Now, expressed in millimeters of mercury. Now, systolic, diastolic. Now, systolic is when we breathe in and then we breathe out, right? So when you take a deep breath in, the blood is being pushed out of the heart chambers into the arteries, right? So that's what they call systole. Now, diastole is when you breathe out, you allow blood back into the heart. Right, so the normal BP, but what you should know is the normal range of blood pressures. For example, if you have like the SFIG in your house and you want to take your blood pressure, like the picture you're seeing currently, and you want to take your blood pressure by yourself, you should know the normal range when it is elevated, when it is probably stage one, or when it is stage two. So the normal blood pressure should be below or equal to 120 slash 80 millimeter mercury, right? And for an elevated BP, you have 120 to 129, right? And for the hypertension stage one, it is usually between 130, 139 stroke 80, 89. So hypertension stage two is 140, 190. Then it's very alarming. So when you're when you check your BP and you have like 120, 180, 110, 79, 111, 113, 72, 77, 78, quite in the normal range, right? So you're okay, your blood pressure is fine, everything is okay. But when it's reading 120 to 129 over 80 to 182 and all of that, it's elevated. It means maybe there's something probably wrong somewhere that you need to like maybe reduce or do, or just calm down about some certain things, and it's elevated. But when you have 130, 139, 80, 89, that's hypertension stage one. Like 40, 90, that's stage two. Then you need to see the doctor, right? You need to like take drastic actions. Now we get going further, I would see what causes this, the elevated, the hypertension stage one, the hypertension stage two, and what we can do, right? So if we move forward, sorry, we have hypertension prevalence in youth, right? So hypertension is a significant NCD affecting youth in Nigeria. Now, in 2015, a data survey was done by Ministry of Health, right? Nigerian Ministry of Health. In 2015, hypertension prevalence in Nigerian youth was 8.5%. Now, by 2023, to indicate a significant surge in hypertension cases, it increased to 11.2%. That's a significant increase. It shows that by 2015, youths were not having to deal with maybe hypertension as a major thing. It was basically just normal, or it was happening to a smaller demography in the community, or the major demography, which is the adults, the older ones. Now, fast forward to 2023, we have a surge, and by projections it's going to 20%, 21%, 22% by expectations or by statistics. Now, this indicates a worrying trend in hypertension cases among the youth in Nigeria. Now, what causes hypertension in youth? Now, the major thing is we are all guilty of this, one way or the other. Unhealthy diet, unhealthy lifestyle, stress and poor sleep, and then the last one will be family history. Now, on healthy diet, we take high intake of salt, saturated fats, sugary foods, and there are some of us that we cannot go a day without taking Diet Coke, without taking Coke or Pepsi. Some of us take like two in a day. Some of us, it's a ritual. If you do not take Coke in a day, you're not feeling okay. Or if you're cooking, you put like 2 full spoons of NaCl, sodium chloride, salt in your soup or in your Indomie, or when you buy Indomie, you keep extra Indomie sauce. So when you cook one, you put like 2 sachets. Things like that. Saturated fat, junk food. They are on healthy diets. Now, statistics shows us that only about 20% of Nigerian youth consume balanced diet. And balanced diet basically just requires you to eat more fruits, stay away from saturated fats, processed foods, make your own homemade food. I know it can be easy. Some of us, we like suya, suya. Every night we take suya, and is bad. Let me just put it like that. It's bad. Some of this lifestyle food food choices that we make, we just we some of us every day of the week we take junk food. We don't even cook homemade food, no green food, no vegetables, no fruit, nothing like that. You can just say, okay, I'm eating this morning, and then I'm eating watermelon after. I'm eating this, and then I'm taking an apple after. I'm doing this, and I want banana after. That way, you're complementing whatever it is you're eating. But some of us, we don't eat fruit. If we are Muslims here, we only eat fruits when it's Ramadan. When we fast and then we are done with fasting, we just want to eat fruit. That's the only time we basically pay attention to eating fruit. So unhealthy diet is one of the causes of hypertension in youth. Another one is unhealthy lifestyle. Now, some of us have sedentary lifestyle. What do I mean by sedentary? Some of us, or some of us, I like to put us because I'm trying to make it inclusive. One way or the other, I've been in this position, right? So we wake up in the morning, our phones are by our side, we press our phone, they will beg you to go and brush your teeth. When you brush your teeth, you are back on the bed, right? And then you still lie down on the bed till your junior sister or your junior brother cooks food and bring it to you. You still eat your food while lying down on the bed, right? And before you know, you press your phone. It's already 4 p.m. Okay. You just stand up, take your bath, take some pictures and do some videos for TikTok, and you're back on your bed. You're not active. So a lot of us do not live active lives, right? And sometimes substance abuse or substance use, maybe like that, smoking and alcohol, they are unhealthy lifestyle that can increase your risk of having hypertension as a youth. So, and physical inactivity also, lack of regular exercise. You can't do 5 push-ups. You can't walk some miles. From year to year, you try to do something. You don't have endurance, and that's because you've not you know not practice regular exercise. It can be 5 minutes. It doesn't have to. You don't have to go to high fitness gym. You don't have to carry 100 kg of weight to say I'm actually fit or you're doing exercise. Exercise can be 5 squats in your room, 2 push-ups in your room, 3 sit-up in your room regularly every day for a week. When you wake up, you brush your teeth, you pray, you stand up, you do 5 squats, you know, you do 2 push-ups, you do three sit-ups, and then before you are good, you just stretch your body and you do it consistently, you see the difference. Right? These things they look minute, but they actually go a long way. So 51% of Nigerian youths are physically inactive currently. 2023 data shows that 51%, that is slightly above half of the whole Nigerian youth are physically inactive. And most of the time we say, oh, we don't want to go to the gym because people that go to the gym, they just use it to make content. That's why you can use your house, you can use your room. It doesn't have to be heavy lifting. It doesn't have to be rigorous exercise. It just has to be exercise and being regular. Another one is stress and poor sleep. As a Nigerian university student, you will be stressed. Yes. As a Nigerian university student, you probably have poor sleep. Yes. But you should also know that high level of stress and chronic stress and poor sleeping patterns, they increase your chances or risk of having hypertension. Right. And 37% of Nigerian youths reported inadequate sleep. 36% of us do not get regular sleep. What is regular sleep? 7 hours max. 7 hours, 8 hours. Good sleep. You know, 9, 10, you sleep, 8, 9, you sleep, you're up, as early as you can, maybe 6:37 or 5:36. But some of us we sleep one. By 4:30 again, we're up 4 hours 30, and we say, God, I've slept. You know. So the importance of sleep cannot be exaggerated. We need to emphasize on it that getting proper sleep, right? Getting proper sleep and reducing stress, finding your stressors and eliminating them would help you, reduce your risk or chances of having hypertension as a youth. Right now, the last one is family history for me. Now, it's important for you to know your family history because 12% of Nigerian youth have a family history of hypertension, and it's not a bad thing, right? If you observe that your mom, is taking some hypertensive drugs, sorry, if you observe that your mom is taking some hypertensive drugs or your dad, has been in and out of the hospital or he checks his blood pressure regularly, it is a marker for you to pay attention to yourself, right? Because family history is a thing. And so hypertension is one of the diseases that can be inherited. Yes, it's not just money we can inherit from our parent or property. We can also inherit hypertension. So that's why we say early detection, right? Proper management, lifestyle modifications, they all help to manage it properly. So if you observe that one member of your family, maybe it's your aunt, Maybe it's your uncle, maybe it's your dad's brother or your mom's sister or your mom herself or your dad himself that is treating or is managing hypertension, right? You should pay attention to yourself, right? So, complications. Now, if one has hypertension and does not know or knows and is not being properly managed, what can it lead to? Right. Now, thing is, one of them is cardiovascular disease, right? Increase of heart attack. It's possible that the person will just, have heart attack out of nowhere and then they just say, oh, slum. You'd have hear people say, Oko Joko ni, Oko slum. Some people will say, Oko Sun, Oko Jimo. A lot of things that, happened underground. Probably there was a high surge and, it just like went off really. So people just say, Oko Sun, Oko Rini, Oko slum. Oko Joko Moto, Oko Jesoromo. That kind of things, they like happen regularly. Another one is kidney damage. Yes. So the kidney damage with hypertension goes vice versa. So as a young person, if you are diagnosed with high blood pressure, so one of the first thing they will tell you to do is to do your electrolytes and ions test. Yes, electrolytes. So they check your creatinine, they check your urea, and they check your electrolytes. Right. So this is to know if it is a result of a kidney problem that is causing the hypertension. So when someone has a kidney problem, right, it's very likely that the blood pressure would increase, right? So and also vice versa. If somebody has a high blood pressure, it's very very likely that it would destroy the kidney. So this is not something that we should take like with levity. Yes. So it's very possible that somebody has an elevated blood pressure, right? And the underlying the person already has a kidney problem that he doesn't know. But because he has been able to flag that there's a blood pressure, which led them to doing a kidney function test, right? And they discover it, which can be treated on time, right? Because people used to say ignorance is bliss. But with your health, ignorance leads to destruction. If you want to feign ignorance, it becomes worse. Whatever it is in health, early detection is the key, right? Whether it is a communicable disease, whether it is a non-communicable disease, early detection is key because there's stages of of what will I call it? I can't say growth for a disease, right? But I can't find the word currently. So if you detect it early, it can be easily treated, or it can be caught easily, right? But when it's late detection, probably in the late stages already. So kidney damage is one of the things that can occur from hypertension. Another one is vision impairment. So vision problem. So when somebody has hypertension, there's high probability that the vision can be impaired too. So it can cause damage to the blood vessels in the eyes, leading to the vision impairment. Also with kidney problems. So if you have hypertension, if somebody has hypertension, which causes kidney damage, it's a ricochet effect. Also causes vision problem straight up. So we have aneurysm too. So hypertension can weaken blood vessels, increasing the risk of aneurysm formation, and that's not good. Anywhere that there's like a blood vessel, hypertension can cause aneurysm there. If the blood vessels, they burst, it's problem. Somewhere like in the brain, somebody say, just go mad, and all of those things. So let's move forward. Okay, let's take a break for a minute. So any question? I know there are questions. So, or there's like something I said that you didn't understand, or somewhere you want clarity on, or anything. Let's just take that 1 minute break and you can ask. All right. So I'm with you guys.
Yes, we are with you too, sir.
Yeah, I'm asking. I'm sure there's one person that must say something, and it's not you, Sheriff. Then one person must ask me something. Maybe there's somewhere that you do not understand, or there's somewhere that you need clarity on. Fumilayo Oluwatobi, Faith, Christiana, my Oga Francis, Tosin. I know you can hear me, so anything. Christiana, you want to say something? Oh, okay. My Oga Francis said nothing for now. All right. Let's carry on, sir. All right. All right. All right. Can you see my screen? Is my screen visible?
Yes, it is.
All right. Thank you. All right. So prevention and management. I'm sure in between when I was mentioning the complications, the causes, I've mentioned like prevention and management. So stress management. So there's need for you to understand what stresses you and when your stress is at its peak and how you can minimize or curb this stress. Because if you're constantly stressing about a particular thing, or maybe you realize that when you play football over a long period of time, like 2 days, and then you check your blood pressure is elevated, you realize that if you rest, your blood pressure tries to come back to normal. So that's like a stress for you. So reduce your intensity or how long you play football. So that's just like an example. So when you discover what stresses you, you try to like minimize it or you curb it. So managing your stress effectively can like help you. Also, getting good sleep. So if you realize that you're getting 3 hours sleep, try to increase it to 5. I know that we all have one or two things that we do. Some of us work best at night. So you can complement for it during the day, right? So try to get good amount of sleep. Try to manage your stress too. Also diet, healthy diet. As I said before, try to like include fruit in your diet, vegetables, try to like reduce your salt intake and reduce how much you eat processed food. When we say processed food, like bama, like canned bean, and all of those, processed already processed food, Maggie, all of those things. So try fresh food, fresh fruit, fresh vegetables, fresh food, whole grains too. All right. So regular exercise, as I said earlier, it doesn't have to be rigorous exercise. It could be you in your room, doing 5 squats in a day in the morning, doing 3 push-up, 2 sit-ups, stretch your body, and you do it constantly, regularly. It increases your lifespan. Also, we have limiting your alcohol and smoking. Yes, you have to break the the bond with smoking, and then alcohol can limit it. It doesn't have to be in excess. It doesn't have to be too much because it increases the risk of having hypertension. Also, regular checkups. So I know that if nothing is wrong with us, we don't go to the hospital. Sometimes just walk into the hospital and say, I want to check my vitals. What are your vitals? Your blood pressure, check your weight, check your height, get your BMI, check your heart rate, and the normal ones. Just do regular checkups regularly at intervals because it's very important, very, very important. And if I'm speaking to you already and you've done checkups and you realize that your blood pressure is on the high or very high, and maybe lifestyle modifications cannot change it, it's definitely important that you see a doctor, right? And then if you are taking medications, take your medications regularly. It's very important. Very important. So stress management, healthy diet, regular exercise, limiting your alcohol and smoking, regular medical checkups, and medication. Right. So just for data purposes, survey in the world, right? Now you should keep in mind that hypertension is in youth is dynamic area of research, and the prevalence rates may change over time due to various factors. Regular health surveillance and public initiatives are essential to monitor and address hypertension. So over the world, just look on the map here, we have USA 45%, we have Brazil 32%, Nigeria is relatively low, currently 12% for youth, China 27%, Australia 22%. So in conclusion, right? So data survey reveals a concerning increase in hypertension prevalence among Nigerian youths from 2015 to 2023. So we went from 8.5 to 11.2%. So on LD dietary patterns, sedentary lifestyles, poor sleep, high stress levels, and rising obesity contribute to this trend. Yes, if people are telling you if you're a plus size and people are telling you to lose weight, it's for your own good, right? Because obesity is directly proportional to hypertension, right? So when they say lose weight, it's LD to lose weight if you're on the plus size, right? So to curb hypertension, we must adopt healthy diets, engage in regular physical activities, manage stress, and promote public awareness. Now, addressing these factors through targeted interventions and awareness campaigns is vital in coping NCDs and improving young health in Nigeria. So conduct regular checkups at intervals. I would stress this: conduct regular checkups, and if you feel like maybe something is wrong with you, go for your checkup. Even when nothing is wrong with you, go for a checkup, right? So it's important that you detect it early if you have it, and if you do not have it, reduce the risk. Don't increase the risk. Oh, I'm LD, my blood pressure is 112. I can be doing this all the time. I don't need to do exercise. I can sleep as long as I want. No, you are increasing the risk. So thanks for reading. Yeah, we've come to the end. So my sources are gotten from Nigerian National Health Survey, the World Health Organization, Center for Disease Control (CDC), American Heart Association, and Nigerian Ministry of Health. So we've come to the end, and just to do like a quick recap, we talked about NCDs, non-communicable disease. We said there are different types: cardiovascular, the ones related to blood vessels, strokes, coronary artery disease, hypertension, heart attack, to mention a few. We talked about diabetes, which is related to blood sugar, so an increased blood sugar in level and blood sugar in the body, and which is caused by the body not producing enough insulin. Then we mentioned other NCDs, which include obesity, CRDs, chronic respiratory diseases, cancer, meningitis, the ones that cannot be transmitted from one person to another. And then we talked about the prevalence in Nigeria. In 2015, we had about 8.5% hypertension in youth. Now it's about 11.2%, and increase in projection is saying 15 to 20%, in the nearest years. And then we also mentioned the causes on healthy diet, on healthy lifestyle, lack of physical activity, poor sleep, high stress, chronic stress, and then we talked about family. So it's important that you check your family trend so you can it can give you an insight, if because family people that have like history of hypertension in their family increases their risk. There's like a 12% risk. 12% risk. So we also talked about the prevention, right? Stress management, healthy diet, changing your diet or adopting a more healthy diet. And then we talked about physical activity, regular exercise. We spoke about, um, stress management, physical exercise, regular exercise, healthy diet, and the rest. So, medication, if it has been diagnosed, take your medications regularly, and checkups. It's very important that we go for your checkups. So, it's not a death sentence. If you're 18, if you're 19, if you're 20, if you're 21, and they say your blood pressure is increased or is elevated, it's not a death sentence. You don't have to panic. And then, contrary to the proper opinion, where somebody, when you go to the hospital or somebody say, blood pressure is a rise, kilo n ro, you know, it's not always about kilo n ro, or somebody broke your heart, or what are you thinking about? I mean, it could be a factor, right? But that's not even the only factor, right? So it's not just when somebody tell you, "Oh, my blood pressure is increased," then you go defensively and say, who broke your heart? What are you thinking about? As small as you are, what are you thinking about?" There are several factors that could have led up to that. So most of the time, the normal responses is, I'm okay, right, kill on row, or maybe the stigmatization that comes with it. No, it's your health. So you take charge of it, right? So once you've detected it, you speak to a doctor, a consultant, and then if you're just going to modify your lifestyle or if you're going to be placed on the medication. And if you don't currently have it, or if your blood pressure is currently normal, try to stay away from what increases the risk. All right. So we've come to the end of today's August Digest. Thank you. And then I would be taking questions or insights or additions or subtractions.
All right, thank you very much, Mr. Musa Olaiwa. Thank you for that incredible presentation. I must say, and I hope that every other person, like would believe with me or agree with me that this is an incredible presentation, sincerely. And I have some adjectives to describe this presentation. Yes, and I know that other people will also have good adjective to describe it. For me, this presentation is interesting and very much relatable and so powerful because it inspires some action like henceforth. Thank you for everything that you've done. And at this moment, okay, so before we move on, in the middle of this section, we have some of our creators that joined. Creator Fumilayo and okay, Tosin and Yetunde. Good evening, you are welcome. All right, and also Oluwatobi and Oluwadunsin. Good evening, you are welcome, and thanks for being here today. Trust you are good. So at this point, before we move to question and answer, I'm sure every one of us will must have at least one question to ask. Yes, because this is not a section where you will come and you will not have question. Yes, I know there must be a lot of questions going on in our mind. But before we move on to questions, I would like everyone to see at least one thing that serve as your takeaway from this section. One thing that stood out for you. Yes, for me, yes, I think I should start with me. Say the part, although I have so many takeaways from this section, but the one that stood out for me is the part of where our facilitator told us about stress and poor sleep as one of the causes of hypertension. And for real, and I know everyone other person would agree with me that there are a lot of banters around having good sleep or not. Yes, there are a lot of motivational speakers that will come to you and say that yes, before you can achieve great things in life, you have to sacrifice. You have to sacrifice your sleeping time. And other people will tell you that no, you must have good sleep if you want to be productive. And recently, what I've realized is that even before you can really be productive, you need to have a good sleep. You need to have and I think recently someone told me that since he had been paying attention to his sleeping time, not sacrificing it, he has realized that his level of productivity has significantly increased. And I think that I've been realizing it in my personal life too. So let's pay attention to that. And that's the part that really resonates well with me. So at least one person, I want one person, at least one person, to signify and tell us which part of this section stood out for you. Yes. So I'm looking for and all right, Christina. All right, please shoot. Thank you. Christina, let's have you.
All right. Good evening, everybody. Can we hear me?
Yes, I can hear you.
All right. So first off, I want to say thank you to our facilitator for today. Thank you so much. Okay, what stood out for me? Sharifdin already shared the poor sleep factor. I'd like to point out the unhealthy feeding part, right? The funny thing is, even as we were on the call, as it was about mentioning that, I just took a particular chocolate biscuit and I was eating it. So as it was discussing, I was feeling guilty. Although I finished it though, but then I think I'll pay more attention to that. I think all of that is based on the fact that we are trying to get a lot of things done. We don't want to cook because there's no time to cook and all. But after the session today, I've realized that if I do not plan to start sacrificing that time to eat good meal or to structure my feeding right, I'll end up having to spend time on treating hypertension. And I don't want that. So yes, thank you very much for that.
Okay, thank you, thank you. I think this is one of the reasons I said this section is actually relatable. Yes, very relatable because yes, there are a lot of what do I call it, shakes that like Nigerian youth are facing almost every day, and this is one of the reasons that we cannot even we could not even pay attention to almost all of these things. Yes, it's very relatable, and I think everyone will resonate with this a lot. So can we have one more person before we move to question and answer? One more person, your key takeaway or anything that you feel that you resonated well with. All right, Itunde, shoot. Thank you.
Good evening, everybody. Good evening, Miss. Thank you very much. Although I came in late, I'm very sorry. I had to sort out some things. So, the major thing for me is the going for checkup, even when you're still feeling all right. When we think you're fine and you're not feeling any pain and all, there's still a need to walk into the hospital for checkup. And that thing is the whole mentality about someone that is hypertensive. We think that the cause is thinking. There is no majorly thinking. Some can be hereditary and all. So I think that those are like the major things for me. Thank you.
Yeah, thanks so much for sharing that. Yes, depression. So that's contrary to popular mentality. Thank you very much for sharing that today. So right about now, let's move on to question and answer. So if you have any question to ask our facilitator, it's the time to say the question. If you can type on in the comment section, you can do that. That's allowed. And if you want to unmute, all right. Our boss Francis, you can proceed. Thank you.
Which one is boss? Good evening, everyone. Thank you so much, Creator Olaoluwa. I mean, I've been able to grab a few things, and I would like to also say this is like a wake up call to every one of us, because I mean, while going through the lecture, I was like, I knew about some of those things, but then I had to remember some other things that could have that could put put you at risk for hypertension. I mean, the feeding and everything. Thank you so much for the beautiful presentation and the slides. Everything was so perfect. Thank you so much for that. Um, I think the part that struck me where I would be asking my question from is the family um, family tree kind of hypertension type, right? So I'm like, that means you can do everything right, but then still be predisposed to having hypertension because of your family tree, right? So what what um what what ways do you think would be much more better for us to approach that now? Because definitely, if you think you are doing everything right, but then you are already predisposed to having hypertension, what ways do you think we can actually combat that? That's my first question. Then number two, you've given us a data survey of the number of youths in Nigeria that are currently suffering from hypertension, right? So what ways do you think we can actually make this thing go global? Like probably make be spread the awareness about the current state of hypertension, and because we believe that this information is not only for us. We believe that if we are able to inform others about this, they'll be able to take what's it called, proper um ways of their health and everything. So the first question is about the family tree. How best do you think we can combat that? Then number two, how well I mean how what approach do you feel we can be able to um do this? I mean, as an organization now for PMI now, how do you have ways in which you can make this make this thing go viral, like do the awareness and make people know that, oh, this is a big problem. This is the former data, this is the current data, and this is what we think would most likely be in the next 4 years, and this is what we think you should do. Thank you so much once again for the basic presentation, Creator Olalua.
My Oga, CFO. Good evening, Mr. Francis. Yes. All right. So for the first question, right? Yes, you can do everything right. You can have a healthy diet. So you can have good sleep patterns. You can do every other thing right, and still be predisposed to hypertension because your family has a history of it. Yes, it's very possible, very likely. So basically, now you're not avoiding it. What would be the most important thing is you're managing it. so it can be very managed. It's very possible that okay, you're doing every other thing right, and one day you went check your blood pressure, and you're like, oh, my blood pressure is 140 something over 90. How come? I'm very healthy. I sleep on time. I do exercise, regular exercise, and all of that. But if you track back, your family probably has like a history of it. So at that point, it's the management that matters, right? So medical management is the major thing. So your lifestyle is fine, every other thing is fine. Modifications are not necessary in that part aspect. So what would just be the most important thing to do is to follow the medical management, right? So you cannot, if it's something that maybe it was caused by this, it could be tackled by this, or you cannot. But I'm not saying that if your father has and your mother has, you will have, right? Is not a fact. You get is a is likely. That's why we're saying 12%. It's not like everybody that has it, their children, or it can skip, it can fly, it can do anyhow, but basically you're just at risk of having it, right? And sometimes if your family has it and you don't have it normally, right? But if you're not living, if you're not managing there are no modifications to your lifestyle and all of that, you could be predisposed to it. It could happen because you're already at risk of it. So basically, if every other thing is fine and you have it and other modifications are in place and every other thing, so medical management is the next thing. So you just make sure that it's being medically managed, that it doesn't go out of proportion. And for the second one, right, it's a general thing. It's an awareness thing, right? People, let me use Nigeria as a whole as my case study right now. So if on my status I post now, oh my god, how is my blood pressure so high? Right. Now, 80% of the messages I'm going to get is are in two ways. The first one is, what are you thinking about? The second one is, you're stressing yourself too much. Right. Now, what am I thinking about? Fairly correct. You're stressing yourself too much. Fairly correct. But what if that's not even the two things that is causing it? So people are already predisposed to a particular, thing. And one thing is, there was one time around last year, somebody came online to talk about how a 25-year-old boy one day just collapsed on the road and died. Right. And then people started talking about how he has been undergoing stress, no proper sleep. He doesn't even have time for physical activity, for regular exercise and all of that. And what killed him was his blood pressure was high. And then there was a whole, talk about take care of yourself, manage your health well and all of that. So in the larger scale, it will be a proper awareness and a kind of awareness that connects to the grassroots. So for different places, different people, different things connect to them. If I run a campaign today in Nigeria saying, no be only heartbreak fit increase your blood pressure. If you know they sleep, your blood pressure will increase. Right. A lot of people would connect to it. Or no be say they do exercise and your blood pressure no go high. Things like that are people would relate to it in that particular category. And you would see that it is the lack of information that that is the major problem people have. So if there's an awareness on a grassroots level, awareness on a larger scale level, people would understand that these things exist and it's becoming alarming, right? So a lot of young people now are having high blood pressure, and it's because they don't pay attention to some certain things. And there's a shift, there's a paradigm, there's a shift currently where things that don't look normal are becoming normal. For a good example is colorectal cancer. Colorectal cancer, even if you do your research currently, colorectal cancer used to happen to people that are above 40. Now, towards 2020 to 2023, we had a larger percentage of people that are below 30 having colorectal cancer. So these things evolve, and at the end of the day, it's information that would determine how people respond to it. So awareness on a larger scale, awareness at the grass level scale that can connect to people, grassroots connect to people, larger scale, general information. I think that should be able to like help with it. I don't know if that answers it, but I think
Yeah,
that is
yeah.
just
I mean, thank you so much, and I believe the lead creator is also listening because I believe one of the reasons for having digest is for us to get problems and find solutions. So thank you so much for the answer. I really appreciate you, sir.
you're welcome. Thank you, Myoga.
Thank you, sir, for that stellar response to that question. Do we have any other question? Any other question from anyone? Trying to look for it. Questions. All right, so I think I have a question for our facilitator. By my question, also has to do with like the hypertension that runs in family history. Like, okay, you say sometimes it can actually be inherited from like an option can inherit hypertension or not. Although you do not use that word inherit, but you say it can be passed on to the children, right? One of the children. So, do you think it is genetically based, like hypertension, or it just has like environment?
Okay, so that's like a current research that's still going on that cannot be factual, right? There are sometimes that we say, if it was morphology or a genetic disease or something, we could say it was can be genetically passed on, but it's still a current on the ongoing research. But there's a substantial amount of data to imply that if there's a family history of hypertension, diabetes as the offspring, you are predisposed to it. You are very likely to have it.
I think I will be on the outlook for research about hypertension, just to have an updated knowledge about it. Thank you very much for that response. So, any other question? Okay, let me count down from 5 to 0. At the end of then, if you don't have any other question, I think it's a good time to wrap up today's the August digest. So 5, 4, 3, 2, 1, 0. Okay. So thank you very much. I think this is at the point where we are going to depart for today until we meet again for another edition of our monthly digest. And on a final note, I want to say something, and it is the fact it's about the fact that okay, once again, let us appreciate our facilitator before we depart. We are so much grateful for this wonderful presentation. Thank you so much. So on a final note, although this is a monthly digest and we are here to learn, as I said earlier. Thank you. So but I hope that everyone will agree with me that this is not where the redigestion takes place. The redigestion actually takes place after we all leave here. Yes, after you take something inside, after you eat something, like probably food, you have to digest it, right? To to bring out all the nutrients from that food. So let's use that as an analogy. We are here to learn, we are here to absorb, to expand our knowledge base. But really, what we are majorly doing here is just ingestion. We are just here to absorb that knowledge. So that's why the really digestion actually takes place after we all leave here. So I'm leaving it to you and to everyone, including myself. And I hope that we are all going to digest this and it's going to come in handy in our personal life and as a team in Pioneer Medical Initiative, just as Oga Francis said. So right about now, I want to appreciate everyone for your presence here and for your time for joining this edition of our monthly digest. So thank you once again, and enjoy the rest of the day. See you next time. All right, Christiana, do you have something to say?
Yeah, good evening, everyone, once again.
Good evening.
Okay, so very quickly, I just want to remind us again while the call was going on, we had to admit some persons to the call, which is not supposed to be, and that happened because those persons were not joining the call with their Pioneer email. So please and please, if you are yet to activate your Pioneer email, we sent a notification some weeks ago on how to go about that. You can reach out to me or reach out to Deji so we can work on it. Because, like we've said before, a monthly digest is for curators only, and we will gain access by using our Pioneer email. So we don't expect to to start having to admit people. So please let's work on that. And thank you very much for making yourselves available. Also, to add to that, encourage your friends, encourage fellow curators to always take part in our virtual events. It's always a time for learning and unlearning, as we can attest to from today's session. So thank you very much, Curator Laulua. We are so, we promise to implement all. Amen. Thank you all.
Welcome. Have a nice
Yeah, thank you. So bye bye everyone.
Bye.
Bye.